Hi everyone, my name is Michelle and I'm an advisor on the SRA Hub. If you're watching this webinar for credit, make sure that you're no longer than 3 minutes late, that you stay for the whole thing, and that you're joining through your laptop or computer or the Zoom app. As you guys can see, I have two very special guests with me today. I'm going to let them introduce themselves and kind of share everything, you kind of need to know about the healthcare and medical field and how to get started. And just so you guys know, there's both high school students as well as college students in the audience. So take it away. Introduce yourself.
All right. Hi, everyone. My name is Nchedo Ezeokoli. I'm an SRA alum at this point. I'm a first-year grad student at Emory University. I'm getting my master's in public health. So I'm in the global health department with a focus and concentration on community health and development.
Very good. Great. And my name is Julian Medina. I am an anesthesiologist, and I work in San Francisco, California. I'm originally from the East Coast, so I'm from Connecticut. I'm actually here now, visiting family. I grew up there after initially growing up in Columbia in my first few years, then finished growing up in Connecticut, went to college in Boston. Then I was in Southern California for medical school. And I've been all over the country with residency and training, and have been settled in San Francisco for almost 10 years now, working as an anesthesiologist.
Awesome. Do you guys want to each give us like a brief summary of how you guys got to your current career or how you guys chose the grad school that you guys are at?
So I can start with that. So I am still on the pre-med track, and I decided to go to grad school to get my master's of public health because I was interested in the underlying systems that affect the health of populations. So while I'm still interested in medicine and, treating people individually, I was interested in more of the broader structural systems, as we call it, whether it be the government, whether it be community organizations that kind of impact the health of larger groups. So that's been my interest in terms of moving in that direction first before med school. In terms of, so I'll just stop there, actually.
Good. So as far as my journey, it's, I have to bring it back a few years now. It started pretty young, I'd say in high school. So probably like some of the students that are out there listening today. And just, I think some of the teachers in high school saw some talent as far as academic talent in me as a young student. And I just remember that, I guess reinforced the thought that, I could, maybe change the situation that I was living with respect to my career. So I went on to college. My strength tended to be in sciences and math. So I gravitated to those types of majors and classes. And that's where I ended up meeting lots of friends who were interested in medicine and things of that nature. So that's where the conversation started, where the thought of like, maybe someday I could be a doctor. So I would say it started in high school, started to grow in college. And then honestly, at the end of college, I was a little bit nervous about it. It was, back a couple of decades now, but back then, because of the changes in healthcare at the time, it was not uncommon to talk to actual doctors who said, we're almost giving you a warning, like, make sure you want to, the field is changing. It's not what it used to be. So I met a few people who were negative about the field, and I never really quite understood that. It made me a little bit nervous. So when I graduated from college, even though I had taken all the prerequisites, I wasn't ready to quite make that leap. And I went to the Peace Corps for a few years. And just a moment in time where I felt travel would have been interesting, a challenge. I was ready for one. So I ended up leaving the country, working for about 3 years in the Peace Corps. And it was the best thing I could have done at that time for myself, because it really just showed me that I wanted to come back and just get higher level, graduate level education to be able to do a job or a profession that was going to be able to help people in their health. And it was interesting because those 3 years off really allowed me to come back, I think, apply to medical school from a stronger, more mature perspective and more motivated perspective, which that motivation really helped me for the rigors of actual medical school.
Mm-hmm. And what did you guys major in, and how did you narrow in on what career or field you guys want to pursue?
Yeah, so and I graduated from Stanford University 2016, so still recent grad. I majored in science, technology, and society with a concentration in life sciences and health and a minor in African studies. So a lot of words. So my major was an interdisciplinary major that kind of combined science, tech, and health, and trying to understand how aspects of science and technology interact in our health today. And I decided to do that major because I thought it would provide an interesting kind of perspective on medicine and health than we currently have, than I currently knew at that time, because it was interdisciplinary and I was able to take a lot of social related courses. And I am currently interested in terms of medicine and becoming an OBGYN. So I'm really interested in women's health and women's health disparities and health equity. So a lot of the work I do right now in global health is actually surrounding around maternal health and sexual reproductive health.
And just so you guys know, if you have any questions, feel free to chat it in the chat box and we'll address them at the very end of our webinar. How about you, Julian?
So as far as my major was not quite as sort of modern as as the one we just talked about. It was a little more straightforward. So again, getting back to where my strengths were really, I was a biology major at the time. I think the thought of it was that that's where most of my interests were academically, as far as my curiosity of what types of classes I wanted to take. And I knew, and even though at that time, that medical school was an interest, so it just fit in well with where I thought I may want to go, and also what my other interests were in the event that I didn't go to medical school. I sort of wanted to have a backup plan, whether it be I decide not to go to medical school, or at the time, it wasn't a guarantee that I would get into a medical school. So I had to, I guess, come to terms with that potential reality. So I was a biology major. I was a college athlete when I was in college. So I was pretty busy with respect to my time management. So once I sort of got onto a certain track, I certainly knew I wanted to graduate in 4 years. I just made sure that I just continued along that path to be able to graduate in the time that was necessary.
Great. What experiences do you guys have in the field, and how did you guys seek these opportunities, jobs, or internships?
Yeah. So starting from high school, I actually was involved in kind of like bioscience research at UCSF. So that kind of was my introduction into like the medical research aspect of medicine. And so I did that for 2 summers in high school. And then in undergrad, I was fortunate to have many opportunities of summer internships and other experiences that kind of solidified my interest in medicine. So whether it was going abroad and volunteering at like a community health center, doing research abroad, doing internships in other organizations revolving around community health, those type of experiences. So I can talk a bit more about that. I think there's a question further down, so I'll just, give a brief overview.
Okay.
Very good. For me personally, are we back?
Yep, we're back.
So for me personally, as far as experiences early on, in high school, none really. I'll be honest with you. I worked in a kitchen in a hospital in my local town. So I actually, that was my first experience. I remember walking around a hospital being like, hey, it'd be interesting to be a doctor someday. My teachers think I could be one. Pretty early on. And in college, I was able to get a little bit more exposure with some of the doctors that taught on campus, and I worked in some labs doing a little bit of research. Just trying to get exposure to different things. To be honest, not that much experience. What had a bigger impact, honestly, was when I went away after college, and I was very motivated to try and do something, to have a profession that was going to make a big impact. Once you go to medical school, you really start to get a lot more experience, not surprisingly. So you rotate through many different fields, you see many different subspecialties and things that may be of interest. And that's really where I personally started to get a sense as to, where am I going to fit in on this profession, which is something that maybe we can get to a little bit later in the seminar, because it's an important part of figuring out what you're going to do for your career as a person, as a professional, and also as sort of a balanced individual. Because for most of us, our profession is not the only thing we do, and it's not all that we are. And choosing your specialty is, you want to choose wisely, depending on how you want to live your life.
Great. How can high school and college students prepare for a career in the field? And I guess just, maybe in your specific field or just in general. What advice do you guys have for them?
So I would definitely say volunteer if you can. Shadow, whether it be shadowing a doctor or a nurse or a physician assistant, shadowing, volunteering in the community. If you are, you said undergrad, right?
Mm-hmm.
Okay. If you're an undergraduate, I would definitely try to go to, maybe your career center and see if they have opportunities related to internships or volunteer opportunities to seek internships. SRA is awesome, so they definitely have some opportunities as well.
Yeah, I mean, I would echo that. Essentially, is try and use as many resources as you have available to you. If you happen to have a mentor in the field or related field, don't be shy. Reach out, ask questions. There are no dumb questions. If you have a question, it's because there's a legitimate thought in your mind that you're looking for an answer to. Look for people who are interested in working with you and helping that next generation. There's a lot of us out there who are happy to do it. We find a lot of satisfaction, and it's rewarding to be able to work with young, motivated people. And I wouldn't be shy about what the specific experience is. It's just kind of putting yourself out there, challenging yourself. Whether you find something you love or you find something that you don't like, it's an equally valuable experience, because that it's either something you want to pursue or not. And just kind of look for people in those fields and feel free to reach out. Not everyone's going to receive you warmly, possibly, but if somebody doesn't, you just move on to the next person.
Great advice, guys. What do you wish you knew in high school or college about pursuing a career in the field, or about med school or applying to med school? What do you guys wish you guys knew in high school or college?
I think for myself, I would say in high school, I was very focused on the pre-med track, that I didn't realize, I didn't know that there were other tracks I could do, like public health or like nursing. Well, I did know about nursing, or, physician's assistants or nurse practitioner. So I'd say if you are interested in the medical field, don't necessarily narrow in on just like being a doctor. There's so many different ways you can contribute to healthcare other than being, a doctor, that aren't necessarily as commonly talked about, that are just as rewarding. So definitely seek other paths to healthcare or medical, or the medical field, that might also interest you as well.
Yes, I mean, I would agree that the healthcare field is a large one. The doctors and physicians are really just one small aspect. All the nursing care that needs to happen, the ancillary services, or even the biotechnology that is required for the doctors to be able to do what they do. The field of healthcare and medicine and taking care of ourselves and of the country and of the world has many, many layers. And you may be surprised where you fit in, or where you find your own personal talent in terms of your contribution. As far as thinking back, what do I wish I knew, looking back now that I've gone through it? It's a good question. It's hard to prepare. I guess, it's hard work. It takes a long time. It's a large investment. Not only, it's a financial investment, it's a personal, time-consuming investment. Your family is invested in it for you, your friends, people that, you may be working nights, weekends, holidays. That may mean that you might not see mom on Mother's Day. And these are some of the sacrifices that you make for the profession that that you want to be a part of. For some of the sacrifices that you make for the profession that we're in, and it's you know it's going to be hard going in, and just understand that to get the reward will take a lot of work.
Mm-hmm. Great.
I have one more thing.
Yeah,
Sorry,
go ahead.
like that. I'd also like to say that not everyone's path is the same. So I do have some peers who are in med school right now. I have some people who won't be applying until 2 years from now. So just the idea that like we have to do things at a certain time, that there's a certain timeline, is really false. So your timeline is your timeline, and that's like the path and the timeline that you're going to go on. And being okay with that. So sometimes, you need more time or you're not ready, like Julian said. I mean, that's absolutely okay. So.
Yes, I agree.
Can I add to that?
Yeah,
That was,
go ahead.
that's a great point. I mean, yeah, I agree 110%. And the point is, there is no formula to get into medical school and or to become a physician. There are many different paths toward that profession and way of get there. And I think it's okay to be comfortable with your own path. Maybe you've maybe had a year or two where you struggled in college and you weren't doing as well academically as you wished, or when you weren't ready to go. That is perfectly okay. You're going to bring your own personality, your own set of personal experiences and getting yourself into medical school. And then someday when you're a physician, you bring that to your patients. And every doctor isn't the same, doesn't think the same, and thankfully that's the case. Because that's why professionals get together, work together, and that's how we are able to provide good care for people, because we're able to look at things from different perspectives. Mm-hmm. And oftentimes that's really the value that you bring as the individual that you are.
Mm-hmm, mm-hmm. So you guys talked about, challenges. What are some of the challenges you guys had, or doubts or hard times? And tell us how you guys tackle them. Because it's not an easy road for anybody. So I'm sure everyone has their own. So how did you guys tackle those?
So as someone who just finished undergrad was rough. It was really hard. Stanford kicked my butt. And there were times when I definitely struggled academically, and I definitely questioned, like, okay, I want to be the perfect pre-medical student and I'm not doing too well in my pre-med classes. Like, does that mean that I can't be a doctor anymore? It doesn't mean I can't be in the medical field. And there is a lot of doubt, especially, when you're coming from a background where you might not have doctors in your family, or, you might not understand the necessary steps to get to becoming a doctor, which is why we're having this webinar. And I think that a lot of the challenges I had was just being able to reach out for help and to ask questions. So there is no wrong or right question, and to just get as much knowledge as I could. So when I was struggling academically, saying, okay, I need to go to office hours, I need to talk to TA, I need to talk to professor, but also knowing that, like, your grades, they matter, they definitely do, but they're not the end all be all of any application, whether nursing or PA, med school. So it's just one piece of a larger puzzle.
Yeah, I mean, I would agree and just, again, echo a lot of what you had to say. Back in college, much like you, I did not have straight A's from the get-go. Definitely not the case. A lot of self-doubt, for sure. Wondering, can I get an A in one of these hard classes? I'm thinking, I'm only in college. I'm not even in medical school yet. And I don't even know what it takes to get there. I'm not there. So it was definitely getting through that self-doubt. For me personally, what got me through it, I think it was essentially just buckling down and just giving it my heart, my best effort, which is obviously what you do. But at some point I realized I can't do any better than the best that I can do. So I just made sure that if I was going to, not make it, quote unquote, then I was going to go down fighting. Like, I was going to give it my best effort, and I wasn't going to regret looking back. And I think because I really put in that work, I began to mature and blossom as a student. By my junior year of college, I really started to turn things around academically for myself. And I started to figure out much better how to do well in college. I think part of it had to do with my my high school background wasn't that strong academically. So it was a very large transition from an average high school or whatever you want to call it to then a more challenging, rigorous academic college environment. It took me 2 years. I wondered if the grades that I got in the first 2 years were going to be enough to sink me, quote unquote. Thankfully, they weren't. I'll be honest with you. At the time that I applied, my grades were below the average med school entrance person. They were what they were. That was who I was. I was proud of who I was. I was proud of my grades. I worked hard for them. But it wasn't the only part of the application, like you said. And I know, after college, I did some work in the Peace Corps. I'm sure that helped me significantly, not only to mature personally, but I think it also showed a little something about my inner drive and passion and what the willingness I was to work. And then, like I mentioned earlier, I was a college athlete, which did take a significant amount of time. And that would always come up in interviews everywhere I would ever go. People would ask about my experiences. And I just feel that particularly, it was held in high regard, and not just because it was sport. It was just the fact that I was balancing more than just my academics. Mm-hmm. So yeah, it was hard. And you can say the same thing once you go to medical school. Mm-hmm. It all starts over again. You doubt yourself. It's hard. You might not do well on a test. You just I always kind of went back and buckled down and said, you know what, if I'm going to go down, I'm going to go down and give it my best shot, so I have nothing to regret. Mm-hmm. And thankfully for me, that meant that I became a better and better student over time, and I ended up, doing well.
Yeah. Great. And just to add to that, I think that two things that are also very important as well are to, one, find your support system, and that support system can be just one person who you guys share the same goal, you have similar interests, and that could definitely help in terms of making you, like, just the awareness that you aren't necessarily alone, and that you're not really struggling alone, that other people are around you who are also trying to get to the same end goal. And the second thing is focus. So I know, like, sometimes as pre-med students or pre-nursing or whatever it may be, there's a tendency to want to do everything and anything because you think that's going to make you look better, right? So I did like 500 activities and I was in X, Y, and Z, but I think it's also important to just, find what you want to do and focus on those things and be good at them. So I think it's better to do a few things really well than to do everything not really well. So don't feel the need to overburden your schedule with, many activities that you're not really passionate about or really interested in, because it really matters to find your interest and focus on the things that you are interested in. Because when a time comes to apply for whatever school you choose to, it really does, I think, show through.
Mm-hmm, mm-hmm. Awesome. So we have about 5 more minutes. So I want to take some questions from our students. So let's see. How did you find med schools? How did you do your research in terms of finding med schools? And what does the MCAT involve subject-wise?
So I'll start with that one since I've gone through it already. As far as, I went to school in the Boston area for college. I grew up in Connecticut, so I was in New England. So there's a high concentration of institutions of higher learning in New England. So essentially that's how I found most of them. I started by my home state school. That always makes sense for likelihood of acceptance and or affordability. So I started there, and then just local areas between Boston and New England. There are so many medical schools that was more than enough. Mm-hmm. I ended up actually applying to one school outside of that region, just on a bit of a whim from a good friend of mine who happened to be a Peace Corps buddy from California, who recommended a school in San Diego, mm-hmm. because he knew me and he thought that was the perfect environment for me. On a long shot, I applied. Long story short, that's where I ended up going. So it was wonderful because now I still live in California, and I found it a great place for me to live and practice my profession.
So did you just Google med schools, or was there a specific website students can go to for a list?
I may let our other panelists answer that part of the question. I think she may know better than me at this point.
Yeah. So I haven't applied yet. So I'm actually applying next year. But I have started the process of looking into schools, and the process for me is trying to first decide where in the country I want to be. So that's kind of where it is. And then many of the major universities have med schools attached to them. So there is a list, actually, if you just Google list of medical schools in America, there's 300 and something that you can look at if you like. But that's how I've started looking at them. So I know where I want to be. I know what focus I want. So I'm a very community health focused person. I'm interested in serving underserved populations, and there's different med schools have different focuses or different things that they're known for, right? So some med schools are that's the med school. They do a lot of community, outreach. They do a lot of community work. They're really focused on health equity and trying to bridge, health disparities. So I would definitely just look up, if you have a certain focus interest, plug that in, look and put med school next to it. There's also a lot of different boards, what do you call those? Chat boards, I guess. I don't know what they're called. That you can go to. Student Doctor is one of them. They talk about the differences between different medical schools, and it's a forum to give you advice and kind of direction in terms of medical schools as well.
Awesome. So what does the MCAT involve subject-wise, and what was the most difficult part of it?
So currently studying, but the new MCAT has, you have your sciences, you have your chemistry, physics, biology, biochem, and was organic chemistry. And they also have this extra new section was the psychology and sociology section, because now they want, I guess people applying to med school to make sure that they know they're more well-rounded. So there's also a psychology section. Some people take a psychology class. Some people just study that separately. I didn't take a psychology class in undergrad, so that's something I'm going to be reviewing separately.
Okay. Yeah, I definitely took the older version. So sounds like it's a little bit more involved nowadays, so I won't get too much into that. My experience sounds like it was different than what it is currently.
Okay. And is it, looked down upon if you take a gap year during med school? Is it, better if you don't, or how do you?
I don't know for sure, but in my personal experience, so medical school is a bit of a whirlwind. Sometimes they'll use the metaphor for it's like trying to drink from a fire hose. So it is a challenge. So I guess my question is, why would you take one? I don't think it's necessarily ill-advised. Let's say, for instance, you're going to start a family or something, and you need a year to have that happen. I know I had classmates who did that, and that's certainly not ill-advised. That was a smart thing to do, and I'm sure the medical schools would be more than happy to accommodate that for their students. You may have personal, family reasons, or for whatever, that you need a year away from the academic rigors of medical school, because while you're there, you do need to be 100% committed and involved to be successful. So I wouldn't take it to essentially to travel or to do things that may not be absolutely necessary, simply because it's a long road, and I think it's a little bit early to start taking breaks. That's just my personal opinion. Once you're going, I think it's probably easier just to keep that ball rolling and keep that momentum going. If you step away from it and then you have to come back, it's like kind of trying to jump onto a moving trolley again. Yes, you can do it. I would suggest, if you're going to take time, I would do it. It makes more sense in between college and going to med school. And, let yourself rest up. College is very difficult, especially when you're trying to get into medical school. There's a lot of pressure associated with that, which adds a lot of stress to your life. So I would do it before medical school, potentially at the end of medical school before you start an internship. I guess if you felt you needed a year to do something in particular, or if you had some academic things that you were interested in, it's possible. But I'll be honest, it's pretty uncommon. I think partially because by the time, if you imagine, you get to medical, you're going to medical school, we're getting a little bit older. And people do eventually want to start families and things of that nature. And you sort of need to keep that ball growing so you can get that first job, so that you can start to be financially stable enough to be able to try and move into those next stages of life.
Yeah. Okay, so just so you guys know, we're a little over time. So for those of you who have to go, I'm going to launch the post survey. So it just popped up on your screen. So once you take that, you're free to go. But if you want to stay a little bit longer, we have like one more question, if that's okay with our panelists.
Yeah, I like to touch on that question because I have a different take. So I clearly took a gap year to get another degree. And I do know that the age of medical students who are entering medical school their first year has increased over the years. So that average age right now is 27. So that means that, you know, your first year medical student, the average age is 27, which means most people tend to graduate undergrad at 21, 22. So a lot of people do end up taking a gap year. And I know from my colleagues or my peers who I did go to undergrad with, a lot of them are entering med school this upcoming year or last year. So a lot of them ended up taking 2 years off, maybe 1 year off, 3 years off. So it's not necessarily a negative thing, I think. It depends on what you do during your gap year and how that contributes to, I think, you moving forward in that career, whatever career you choose to go to in the medical field.
Yeah, and I'm obviously not in the medical field, but I have a lot of friends who are. And one of my really great friends, he took a year and, you know, took a year off or a gap year, and he went right back into it and he's doing just fine. So I think it just kind of depends on your reasoning and just what you do with it, like you said. So, okay. And the last question, if you guys don't mind. So someone wants to be a nurse. So they go to it. Currently a student at a UC, and most UCs don't have a nursing major. So do you guys recommend that the student finish their, you know, BS degree and go for a master's in nursing, or is that even possible? What would be your advice?
I could speak to that one. So I looked into nursing as well. And nursing schools require courses you have to take. So just like pre-med courses, there are pre-nursing courses. If you don't get your BS in nursing, what you can do is when you graduate and you've taken all your prerequisites, because you have to before you enter nursing school, you need to get your BS still in nursing. You can't get a master's in nursing without a bachelor's in nursing. But if you already have a bachelor's before, what they end up doing is you end up doing an accelerated nursing program. And those accelerated nursing programs for those who already hold a bachelor's are between a year and a half, I think, and 2 years. If you want your master's in nursing after that to become a nurse practitioner, you add in like another year. So I think in all, if you already have your bachelor's in, like, I think you said biochemistry, if you want to do nursing, you would do an accelerated nursing program. And that's like a year and a half. And then you would get your nursing and your bachelor's in nursing. Hopefully that answers whoever's question that was.
All right, any last minute questions? If not, I'm going to let our panelists go. They're actually all in different time zones, so I really appreciate you guys for taking the time out of your evening to share some awesome advice for our students. So thank you. And if you guys have any questions, students, feel free to email us on the SRA Hub. But I'll let you guys all go. Have a great evening. Thank you both. Bye.
Thank you. Bye-bye.